Good morning, good afternoon, good evening to this audience which is scattered across the globe. It's a pleasure to welcome all of you to this special inaugural function of the GAF Global Andrology Forum online academic program. Now, as all of you know, GAF has been very productive academically, publishing more than 24 papers every year. We've just finished 2 books. 2 are in proofs, 2 are being completed. We have had special issues. We have conducted workshops, symposia in countries around the world. We have several more coming up. So in terms of academics, we have been very busy. Recognize that there are many members who don't really wish to be engaged in research, who are not as yet equipped or trained to write scientific papers, but who still join GAF because they wish to learn more, interact more, and brush up their skills in male infertility and sexual dysfunction. So thinking about this large unmet need for a number of our members, we came up with the idea that we should have an ongoing online academic program that will allow junior members in the GAF to benefit from the huge store of wisdom and experience that GAF also has through its senior members. And therefore, this idea of a GAF online academic program was born. The first academic event will start actually next month. This is the special inaugural event today. And the events will be held every alternate month. So after September, it will be November, and then Jan, March, and so on. It will always be on the last Saturday of the month, starting at 10 a.m. EST, because that kind of covers all the time zones. Morning in the USA, early afternoon in Europe, later in the afternoon in the Middle East, early evening in India, late evening in South Asia and the Southeast Asia. So we hope that everybody will be able to participate. The meetings will be only 1 hour long so that it's not a burden on anyone's time. The meetings will be focused on practical aspects. We will discuss both infertility and sexual dysfunction. There'll be point-counterpoint debates, case scenarios, how I do it, operative videos, and the special session on learning the wisdom from the masters. And therefore, today we're going to start with a special event that presages what will start next month. And this is going to be a talk by Professor Kadioglu, who's the father of andrology in Turkey, a renowned figure, a towering figure in this field. And I now hand over to Professor Giovanni Colpi, who will introduce our special speaker for today's very exciting talk.
Thank you, Rupen. Giovanni.
Hi, everyone. Sorry. Well, dear colleagues, it is my privilege today to introduce a distinguished figure in international andrology, Professor Kadioglu from Istanbul. Let me begin by acknowledging the profound contribution that Turkey has offered to the field of surgical andrology. One of its most revered mentors, whose teachings have long guided my own practice, who honored me with his friendship and whose memory I hold with deep emotion, was Professor Alpay Kelami, a Turkish Cypriot based in Berlin. Another Turkish Cypriot and his former schoolmate, Professor Sedat Kedelalolu, was likewise a towering figure in Turkish urology for many years. He frequently invited me to speak at Turkish congresses throughout the 80s and 90s. And it was during those years that I met one of his fellows, a young, ambitious, dynamic, and determined man, Ateş Kadioglu. Even then, it was clear that he was destined to become the maestro of Turkish andrology and a true international legend. Today, Professor Kadioglu is globally recognized for his surgical expertise in sexual and reproductive medicine. His work spans penile prostate implantation, complex cases of Peyronie's disease and congenital penile curvature, often treated with original surgical techniques, microthesis, varicocelectomy, and management of distal ejaculatory duct obstruction. As professor at Istanbul University, he has authored over 275 peer-reviewed articles and numerous book chapters, accumulating more than 8,000 citations and the NH index of 47. He has served on the editorial boards of leading journals, including the Journal of Sexual Medicine, Andrology, International Urology and Nephrology, World Journal of Urology, and Balkan Medical Journal. He is currently the editor-in-chief of Urology Research and Practice. A frequent speaker at international conferences, Professor Kadioglu has represented Turkey on the global stage, contributing to consensus statements and guidelines for the European Association of Urology, the International Society for Sexual Medicine, the European Society for Sexual Medicine, and the Global Andrology Forum. He has trained over 100 fellows from the Balkans, Kosovo, Albania, Bosnia-Herzegovina, Macedonia, Central Asia, Azerbaijan, Kyrgyzstan, Uzbekistan, Turkmenistan, Kazakhstan, and the Middle East. His leadership roles include serving as president of the Turkish Andrology Society and the Turkish Urology Association, and he continues to serve as honorary president of both societies. Internationally, he has held key positions with the European Association of Urology and served on the board of the European Society of Andrological Urology. He is co-chair of the Priapis Committee of the International Consultation on Sexual Medicine and serves on both the Ethical Committee and the Conflict of Interest Committee of the International Society of Sexual Medicine. He has chaired major congresses, such as the Southeastern European Meeting, the European Society for Sexual Medicine, and the Société Internationale d'Urologie, shaping global policy, research priorities, and clinical standards in sexual and reproductive health. In 2021, he received the Distinguished Career Award at the World Urology Congress in Dubai. He has been appointed honorary professor by the Ministry of Health of the Republic of Uzbekistan, the Kyrgyz State Medical Academy, and the University of Pristina, and holds a visiting professorship at Azerbaijan University. In 2024, he was honored with the prestigious Distinguished GAF Academician certification, recognizing his lifetime achievements in andrology through a rigorous merit-based evaluation process that was original, objective, and transparent. Professor Kadioglu's approach to medicine is grounded not only in surgical and scientific excellence, but also in a profound intellectual habitus and epistemological awareness. While firmly committed to the evidence-based framework of modern medicine, he also embraces a holistic view, one that considers the ethical, ontological, and methodological dimensions of clinical practice. His ability to integrate ancient wisdom with the contemporary science sets him apart from conventional practitioners and makes him a living embodiment of the wise surgeon scientist. Today, he will share his remarkable journey through andrology, illuminating new paths for the next generation of specialists. Professor Kadioglu, the floor is yours.
Thank you very much, Professor Kolpi, Professor Agarwal, Professor Kolpi, Professor Shah. Thank you, Professor Kolpi, again for the very kind introduction. I hope I deserved this introduction. And I like also to thank the Global Andrology Forum, especially to Professor Agarwal, for the opportunity. It is a great honor for me to be the first speaker in the series of Pearls of Wisdom. During my presentation over the next 25 minutes and so, do I have the remote control?
Yes, Doctor.
Yes. First, I will discuss why I did choose andrology, and then follow with the definition of my destination at the beginning of my academic career, and follow the design of the presentation as displayed on the screen. So why I did choose andrology? Disorders or diseases can be classified into three main categories. The first category is life-threatening diseases. The second one is organ-threatening diseases. And the third one the third group is consisting of diseases that impair quality of life, but not life or organ-threatening diseases. And sexual and reproductive, disorders belong to the third group. So the reason why I did choose andrology is because andrology is a known field since the ancient times. I remember the Plato statements. He did state that sexuality and reproduction is an expression of the individual's desire for immortality. And his follower, his student, Aristoteles, also did state that sexuality and reproduction is the fundamental principle of nature and the continuity of the human being, of the species. So the reason why I did choose is, andrology is known for the ancient ages, and will also probably continue in the end of the world, of the cosmos. Yeah. The second reason why I did choose andrology is at the time I was about starting, my residency. Andrology was a very new growing field. Remember, the mechanism of erection was discovered by Dr. Liu in 1983, and I did enter the residency in 1986. So 3 years after the discovery of the mechanism of erection, I became a resident. So we didn't know anything about the mechanism of erection at that time. In 1992, ICSI was introduced by Palermo and Fonsericam and by Dowry. And 1999, 25 years before, microtester was introduced by Peter Schlegel. It's a very new technique to harvest sperm from the testicles to initiate pregnancy. So that was the second reason, a new field. And the third one, the reason why I did choose andrology is there were a lot of urologists interested in uro-oncology and endourology, and this will be a very competitive field. And, instead of competing with the heroic surgeons in the uro-oncology field, I did choose andrology, to subspecialize. The second thing to do is to determine the target at the beginning of my academic life. So according to the Seneca, if a man doesn't know to which port he sails, no wind is favorable for him. You should know the destination where you are heading while you are sailing. And I did define 4 goals during my early academic life. I would be a good surgeon first. I would be a good scientist. I will know the philosophy of medicine, and I will try also to be a good mentor. And the final target of the end of the academic life will be a wise surgeon scientist. So at this stage, I like to define what wisdom is. Wisdom is a complex human trait that includes logical social decision making, emotional regulation, prosocial behaviors such as empathy and compassion. It is often morally grounded. So ethics is a part of being wisdom, helping individuals to determine the right course of action in complex situations and promoting the common good. And wisdom incorporates ethical judgment, experience, and the ability to manage life complexities. And elements such as resilience, kindness, positivity, humility, tolerance, creativity, and curiosity are integral to the wisdom. And wisdom is different from phronesis. Phronesis is the wisdom of a fisherman, of a carpenter. A fisherman wakes up in the morning and looks at the sky and predicts the weather forecast, whether it will be storm or not, and does not go to the sea. This is not a true wisdom. It's just a phronesis based on the practical experience of a fisherman. He can predict the water forecast, but it is not a true wisdom. It's called phronesis, according to the ancient Greeks. In the second part, I will also, describe the science is systematic knowledge that selects a portion of the universe and events as its subjects by using experimental methods. That means we cannot do research in all fields of andrology. You need to focus. And science does not seek the answer to the questions what for, but to the question how. So the question to be answered by the science won't be what for is the world created or why is the world created, but the answer the answer to question is how was the world formed. This will the field of the science. The scientific process is conducted through controlled observations. Controlled observations is to determine which elements directly affect the event or phenomenon. And the experiment must be repeatable under the same conditions in Chicago, in Milano, or in India, and every researcher should confirm the same result. This is the painting of Caravaggio in 1602. And as you can see, the doubting Thomas, one of the apostles of Jesus, sticks his finger into the wound of the Jesus, where he after the crucifixion was punctured with a knife by the Roman soldiers. The doubting Thomas is a skeptic one who refuses to believe without direct personal experience. And Jesus told to the apostles and to the people that he is the son of the God, right? And the doubting Thomas is looking for the divine substance of God in the body of Jesus after his death. So curiosity is the first condition for scientific development. You need to be curious in order to be a good scientist. In ancient Greece, science was pursued primarily to satisfy the desire to know, rather than for practical or everyday utility. I think this is very important. To know for the sake of knowledge gave great thought and abstract and conceptual character, leading to the first emergence of theoretical explanations. And this is different from the science in Egypt and Mesopotamia. They also have some scientists, but these were because of the pragmatic reasons. So in the next part of my talk, I will give some advices to be a good surgeon scientist to the young generation. First of all, did I reach my goal of being a good scientist during my academic career? I think we should have evidence for that. And Google Scholar 2025 August reveals that 420 papers are assigned under the name Kadioglu A. And these articles received more than 11,000 citations. And the H factor gained with these publications is 55. And I had also the honor to present more than 1,000 lectures, state of the art, in different meetings, 10% in international arena and the remaining in Turkey. So I think achieve the goal of being a good scientist is achieved. Second thing is, during my early academic career, I did identify three research subjects to focus on. In sexual medicine, Peyronie's disease and priapism, and in male infertility, I did choose varicocele. And in Peyronie's disease, out of 420 publications, 48, 50 almost is related to Peyronie's disease. And we had more than 2,000 citations among 11,000 citations in total. So 1/5 of the citations came from the publications of Peyronie's disease. And 14 H factors are gained, again, with the 8 of the Peyronie's disease papers out of 55. And moreover, I was honored to be a member of the guideline panel of ESSM 2016. And I am serving since the last 6 years as a guideline panel member and contribute to the Peyronie's chapter every year. The second research topic I did choose was priapism. And we had 25 publications among 420, and 750 citations were gained with the priapism publications. And again, I was honored to co-chair the priapism guideline panel of ISSM 20110, and again, to co-chair the priapism guideline panel 2025 this year, and still serving as a panel member at the EAU guideline panel to contribute to priapism chapter. In varicocele, the third target of research interest is varicocele. We had 28 publications out of 420 and 1,600 citations out of 11,000, and 6 of the H factors were gained by the 8 of the varicocele publications. And again, in the guideline panel and in GAF publications, I am honored also to be a member of all these activities. So the goal of being a good scientist and to complete the 3 focus as research interest is probably also achieved. The next aim in the early academic career was also to be a good surgeon. But being a good surgeon is different from being a technician. A good surgeon should also be such an artist. Art highlights originality and personal expression, making each piece unique and hard to replicate. If you do a Peyronie surgery, you need to reconstruct, and it's unique, and that is it is art piece of similar to art piece of an artist, of a painter. In contrast, technician or craftsman emphasizes skill and tradition, often resulting in works that can be reproduced or mass-produced. If you do, implantation of plant prosthesis every day or every year, 200 of them, and do the same surgery, that is not, as you are not considered a surgeon scientist. You will be only a technician. To become a surgeon scientist needs creativity, a deep understanding of the literature, and ability to generate new ideas to solve clinical problems. And surgeon scientists must be trained not only in the art of surgery, but also in the art and methodology of science. I think that's very important to be different from a technician. So is the goal of being a surgeon scientist, good surgeon scientist, achieved? I think the parameter should be to achieve the number of cases sufficient to provide master training with very low, if possible, 0 complications. And also, in addition to these procedures, to the surgical techniques, the publications should accompany those procedures. We had more than 2,000 penile prostate implantation and 750 Peyronie's and penile curvature cases, 5,000 varicocelectomy, I mean microscopic varicocelectomy since the 90s, maybe more. And the fourth goal was to know the philosophy of medicine. Galen believed, he lived in Bergamo, in the western part of Turkey, that doctors should also be a philosopher. According to the British philosopher Bertrand Russell, the definition of philosophy of medicine is asking questions about the questions that medicine asks. So what are those questions? What is life? What is a human being? What is the nature of health and illness? Is mortality and aging a disease? And can they be treated? So during the academic career, I also tried to find the answers of these questions. The philosophy of medicine will save the physician from becoming a technician. It will encourage self-reflection and critical thinking about their profession, keep their creativity alive, and open new horizons. And the next thing to be a good mentor is first to find a committed mentor. The mentor should be an experienced researcher, and of course, to me, it also should be a good surgeon. He should be dedicated and accessible for mentorship, and the mentor network also provides access to diverse skills. And as Professor Kolpi just pointed out, my first mentor was Professor Sedat Talyalov. Actually, we lost him during the COVID time, and he did encourage me to go into the field of andrology. And then in sexual medicine, I spent some time with Dr. Liu and with Dr. Lipschutz in reproductive medicine, and both of them were, excellent surgeon scientists. Dr. Liu did introduce penile venous surgery, which is a very difficult surgery at that time, Peyronie's surgery, and he had more than 700 publications and in H factor more than 100. Dr. Lipschutz, also a good, excellent surgeon with epididymal vasostomy, microthese, microscopic varicocelectomy, is also a good scientist with more than 670 publications. In order to be a good, scientist, you need to have two generation good mentors. For example, Aristoteles is an excellent scientist. Is considered the first scientist ever in the history. And he had Plato as the mentor, and Plato had Socrates as the teacher. So in order to be a good scientist, you need to have two good mentors at your institution. The first generation can never be a good scientist nor a good mentor. The academia is consisting of education and research. And the second leg of the academia is education. And you need to train the residents and especially the fellows. So I had also the opportunity to train more than 100 fellows from Turkey, Central Asia, Balkan, and Middle East. I think this mission is also completed. The academicians should have social support. The family support is very important, especially the wife support. If the wife is not supportive, you are not going to be a good academics. And work and life should be all integrated. The family is the most important thing in the life, but wife and the children should tolerate the academic activities, especially during the early period. If the young researcher does not suffer during certain periods, during the early period of his academic life, then he will suffer throughout his whole life. So that's very important. So suffer for the first 10 years and enjoy in the rest of your academic life the remaining 25 years or so. In the last part of my talk, I am going to discuss the future directions where the sexual medicine is going to be. We know that since 50 years, we have non-specific treatment modalities for the treatment of erectile dysfunction. Penile prosthesis does not reverse the pathology in the penis. It's just, mimics the erection by, prosthesis in the corpora cavernosa. the introduction of the papaverine by Vera also inhibits non-specifically 11-phosphodiesterases, and is also not a specific treatment. Brantley and PG1, phenoxybenzamine, or PG1, by the Japanese group, also did not, is not specific treatment for erectile dysfunction. The first specific treatment was, the discovery of nitric oxide cyclic JMP pathway mechanism, and which lead to the development of sildenafil citrate. So a treatment targeting the pathophysiology of erectile dysfunction by enhancing cyclic GMP levels to improve blood flow. So this is a specific treatment, right? But for the past, after the discovery of the sildenafil citrate, over the past 27 years, there have been no major development in the treatment of erectile dysfunction. We should still rely on the effectivity of the sildenafil citrate. In Peyronie's disease, the situation is worse, even worse. Is first described in 1743, is almost 275 years past, but we don't have still any effective oral treatment to treat Peyronie's patients. Collagen Clostridium histolyticum has shown limited access, 16-degree improvement of the curvature, and we are still looking for a pathophysiology targeted medical and surgical treatment for Peyronie's disease to discover. For priapism, is a similar statement, is very rare condition, and the pathophysiology is still not fully understood. As treatments for priapism, we have penile shunt surgery or penile decompression or implantation of penile prosthesis. Again, non-specific treatment. So a pathophysiology targeted medical and surgical treatment of priapism is still being solved. What will happen 15 years from now? The Peyronie, that's my opinion, is we are not going to, describe the pathophysiology of Peyronie's disease. Therefore, we will continue to do surgery for Peyronie's disease. The prevalence is low, and I don't think that the institutions such as NIH is going to give grant for the research in Peyronie's pathophysiology. For the priapism, is the same, I think, is very low prevalence. But for erectile dysfunction, probably the prosthesis companies will develop new technical advances, prosthesis, and also a more effective medication, more effective than sildenafil citrate or tadalafil, will also be developed because of the high prevalence of erectile dysfunction. So despite achieving 75% success rate with pathophysiology targeted treatments for erectile dysfunction, due to the high number of patients, the industrial companies in collaboration with universities will continue on developing more effective medications in the treatment of erectile dysfunction. So last but not least, Thales was the first scientist and first philosopher who lived in western part of Turkey. He argued that nature is based on a single ultimate substance and theorized that the substance is water. So he said everything is made of water. If water evaporates, air is formed. If water froze, then land is formed. Just in the essence of everything was reduced to a single substance, the treatment of all diseases may eventually be reduced to a single solution. This will be in the next 10-15 years, stem cells. And stem cell therapy represents a paradigm of shift in sexual and reproductive medicine, offering the possibility of regenerative curative treatments rather than symptom management. While still in the experimental stage, it holds a great promise for the future. So again, thank you very much for giving me the opportunity to talk on my journey in andrology. As a last statement, I would say I enjoyed every minute of the journey and don't regret anything I did. Thank you very much.
Thank you very much, Dr. Atish. Your presentation is going to be a historical presentation forever in the field of andrology, at least for me and thousands of other andrologists who are out there who are listening, and many of them are here along with us at this time. So thank you so much for sharing your journey, a remarkable journey from Istanbul University to training in the United States under your other legends, Professor Tom Liu and Larry Lipschultz in Baylor. Your expertise, your insight, your leadership, your clinical practice, your mentorship. These are some of the things that will resonate with all of us. Your philosophy, which you shared so much here with all of us, is something for us to cherish. Try to understand the secrets that make such a great man work and really influence people all around him and all over the field. So I congratulate you on this amazing journey, amazing career, and for being a person of such humble character, to be a friend of thousands of people in so many parts of the world. You are truly not a Turkish father, but a international father of andrology, truly in my eyes. And I think in the eyes of so many, you make us all very proud for the profession of andrology, which really is growing and really prospering under your influence. So I want to again thank you from my side, from the side of the Global Andrology Forum, for your very amazing and inspiring presentation. Thank you so much. And
Thank you very much. Thank you, Professor Gabal.
thank you. And now I would like to quickly introduce Dr. Rupin Shah, who's here and who will be starting a fireside chat. But before we do that, I want to briefly speak a few words about Dr. Rupin Shah. Many of you actually know him personally and also from his work in the Global Andrology Forum for the last 4 years. And Dr. Rupin Shah is a senior advisor and consultant and of the management in the Global Andrology Forum, what we call as the core team of 6 senior advisors who are guiding us in terms of managing the strategic issues that are there. But he is more than that. He is involved in almost all the projects that are going on a day-to-day basis and working tirelessly on day and night besides his very busy practice in Mumbai. He is naturally a father of andrology in India, and he will have his own presentation similar to Dr. Atish in the coming year. But right now, I invite Dr. Rupin Shah to begin our discussion in a friendly discussion with Dr. Atish, where he will and Dr. Giovanni will ask some questions to really understand this amazing person and personality of Atish, so we can learn something outside of his journey in surgery, in Peyronie's and priapism, and so many complex procedures that he has mastered. So we want to learn something more, which probably is who is Atish, how is he as a person, and what we can learn from him that he will probably share with all of us. So Rupin, it's all yours now.
Thank you, Ashok, for that warm introduction. Thank you, Professor Kadioglu, for a fascinating journey through andrology, laced with philosophy and science. It was a wonderful journey to go on. And this term that Ashok has coined, fireside chat, I really wish it was in person, sitting around a warm fire with a glass of wine chatting with you. But meanwhile, in this online remote world, a few questions, a couple of things that struck me in your journey and which I'd like to ask you about. You did mention why you chose andrology, but a step earlier, what is it that drew you into medicine in the first place?
Actually, it was, because of the, family profession. My father was a professor of nephrology, and during my early childhood, I did witness his philosophy and the respect of the people, other people. I mean, his social status in the society, and so we are three. I have one brother and one sister. We are three children. All of us became, medical, physicians. So it was such a given, job by the family. Of course, I liked it. I mean, I could have go also into the engineering, to study, but it was a given profession given, by the family. That is the reason why I did choose andrology. Why I did choose urology is to answer your question, the second part, because of again, with the relationship of the father's, subspecialty. Urology is very close to nephrology, and I thought it could be better to have the, expertise gained by my father and reflect this to urology. So that is the reason why I did urology.
So it was really a family business which is still going on. And
Yes.
just to take it further, after you trained in Turkey, you went abroad to the US and worked
Yes.
with two of the stalwarts. Could you tell us a little bit more about the time you spent with Tom Lu and then at Baylor and how it
Yes.
impacted you and what you learned? And
Yes.
what you
Actually,
advise younger andrologists about going abroad to broaden their horizons?
yes. Yeah. I think the at that stage, we all knew that most of the research is conducted in US. About 70% of 75% of the research, all publications came from US. And moreover, the pioneer, who did define the mechanism of action, was in San Francisco. And during my residency, I had the Urology Clinic of North America series. And in this series, he was also, Dr. Liu was also, editor. And he wrote Physiology of Erection, Pathophysiology of Erectile Dysfunction. And he was also an excellent surgeon. He did also, write the, penile surgery and surgery for Peyronie's disease. So I thought this is a wonderful man to go and to spend some time. Total, I spent 9 months in US and 5 months with Dr. Liu and 4 months with Dr. Lipschutz. I had also two opportunity to work in the laboratory in his research lab because he was doing, cadaver study, the anatomy of the penis. And I was able to write two papers with him. And then the second giant of infertility was the Dr. Lipschutz. So then I spent also some time with him and learned about how to, develop, how to set up and, reproductive medicine practice, EV, QRED, VV, microscopic varicocele surgery. And he was also a true scientist, surgeon, and also a philosopher like Dr. Lu. So two of them were, real mentors for me to improve my, scientific and, surgical skills. I think it is very important to choose the fellow. Of course, at that time, Professor Kolpi was also a good option. Professor Kelami unfortunately died. John Pryor was also a legend in the UK. I could also have spent some time with these two legends, Professor Kolpi and Professor Pryor, but somehow my, path lead to US, San Francisco and Baylor.
That was truly a remarkable opportunity. Two masters, one in sexual dysfunction, one in infertility. And I'm sure a lot of what you gained from there, you were able to translate into your work here and pass on in turn to your students. I would hand the mic to Dr. Kolpi. Giovanni, if you would like to ask some questions.
Giovanni, you have to unmute.
Unmuted.
Yes. Okay, sorry. Professor Kadioglu, you presented your beautiful travel in andrology from the beginning when you were a fellow Professor Telalolu and all of your mentors, and then until today, when you are recognized as one of the most important experts in andrology in the world. Well, and your presentation was very inspiring, and I would like to ask you, well, what advice do you give to young andrologists starting their careers? Because we know that there are few andrologists at the moment, because it seems that andrology is not a satisfying specialty for young people. Most of them, they prefer to be full urologist, not andro-urologist. Okay, but what advices would you give to them?
Actually, the medical paradigm of the the definition of andrology is, I think, a little bit changed over the last 5-10 years and so. I may stratify andrology into two categories at this stage. Office andrology, or what I call core andrology. I mean the surgical andrology. So immediately after the urology training, the young generation, wants to make as soon as possible a lot of money without spending any effort. Therefore, they prefer to be, shockwave lithotripsy, shockwave treatment for ED. They do penile enlargement, penile lengthening, and office work mainly. So I don't think this is a true andrology. So I think a good andrologist should also be dealing with core andrology. To treat Peyronie's patients, difficult prosthesis, epididymal vasostomy, and phalloplasty, etc., should be a part of the practice. What I recommend is not followed up by the young generation. I recommend them to work a lot. I recommend them, to suffer, work 16 hours per day, but they have the leave immediately after they are on duty. The next day they are off. That means, 1/5 of their education is failed. So it's this time to be trained is shortened. So because of this, they like to prefer, instead of going difficult peroneal surgery, 3 hours, doing a patch, etc. They do inject some medicine into the penis. So it is different time at this stage to establish a good communication between the residents and fellows. The fellows are better because they are dedicated. They are more dedicated, but the residents, they are only the Z generation. They are mainly on the light, low-hanging fruits in terms of research and practice. They don't want to spend hours and in the research laboratory or in the OR to do difficult and heavy surgeries. So I recommend them to work hard, to be honest, to be ethical, and to be modest. And some of them will inspire from my repetitive recommendations. So in the ancient Greek, the Platon said, keep on repeating to the fellows, to the students. Some of them will understand it later. So everything you say, everything to do, will leave a mark in the mind of the residents and fellows, and in the future they may recall this recommendation and change their goal to achieve. And also to be a good model. If you say and don't behave like what you are saying, then it is not a good mentorship. You should also be ethical. You should work hard, and you should publish. You should train people, and only by seeing they can understand what the true mentorship, true scientist, and a good surgeon should be.
Thank you, Ria. Well, I fully agree with your underlining the need of ethics in our specialty, because you know that our specialty is very peculiar, and the risk of unethical behavior, mainly for economic reasons, is very high. Okay, and therefore, I would ask you, what legacy do you hope to leave for Turkish andrology and beyond?
So the question is, again, Professor Kolpi, what would you like to know? I didn't quite understand.
Your legacy to all Turkish andrologists, and also all the international andrologists.
For Turkish andrologists, most of the Turkish andrologists are, trained at our university because, we are one of the few centers, is probably only one, who give a fellowship for the sexual and reproductive medicine. So most of them are trained by our institution. And they observe the behavior and of the mentor and also of the faculty at the institution, and they try to mimic it. But of course, as I said, the generation, gap, differences may probably it does not enable it to mimic it 100%.
Thank you. And well, a last question from my side. Well, you know that I am older than you, and I am still active. But I wonder what keeps you motivated after decades of work? What is the reason why you are going on working now?
Actually, I think, as I said at the end of my talk, I enjoy every minute. I mean, my best time is to
Yes.
spend, to see patients with the residents in the outpatient clinic and to do, surgery with them. So I think andrology is like, hobby, a leisure time activity for me. So
Yes.
therefore, because I enjoy every minute, and that is something I like. I repeatedly wake every morning at 5:30 and try to be at 8 at the hospital and see patients, do research and do surgeries, difficult surgeries at that time because a lot of referral from all of the country. Second, redo cases, infection, explanted implants, etc. And it is fun. So it keeps me, young in, some words, and healthy, and continue my, practice.
I understand. I fully understand you because passion animates both of us. Thank you, really. Professor Agarwal.
Thank you very much, Dr. Giovanni, for your questions for Dr. Atish. I am looking, I think we have asked a lot of questions from Atish. He actually explained so many things during his friendly lecture, which was very insightful. I just have few things and he can tell me. I think, Atish, in your opinion, what makes someone a strong academic or clinical leader?
I think the first thing is the personality. I mean, you should have your stand. I mean, to be a good, good human being stand. That is the first thing. Without, personality, whatever, publications you do, I mean, the number of the cases you did does not count of being a good surgeon scientist. So the personality is the most important thing. And to, I mean, have never leave the ethical and deontological principle is, I think, the second important step is a necessity. Without being ethical and without following the deontology at your institution, you cannot be a good scientist, or I mean, whatever surgery you do is not, valid, is not worth. So I think the personality and with the trying to publish as much as possible, try to do the operation with a low complication, if possible, with zero complication, makes somebody a leader. And also the training to share your knowledge with others is very important, because as a mentor, I mean, after having shared your recent knowledge with the fellows, you will learn new things. So there is no reason to hide. If you are not going to be a mentor for the young guys, for the fellows, then they will find another mentor, like I did go to US. So therefore, I mean, the sharing of the knowledge and experience is also makes you leader. And also, honesty is very important. At the beginning, if you tell what you think, people don't like it. But at the end, they have an opinion on you. And if Dr. Kadioglu says something, then he thinks it doesn't mean it. He really means it. So that's also the another aspect of being a leader. And also the leader character is also should be brave. In some certain situations, I mean, you have to decide. The decision could be not almost in favor of you. You may also losing your position, but you should be brave and let the other people to follow you. I think these are the several, characteristics to be a leader.
Thank you. I totally agree with what you are saying. I think I have seen you in these roles over my life in the last 30 years since I've been friends with you and knowing you by visiting you and visiting your beautiful country for so many time. I've seen that you have been most gracious, you have been most gregarious in terms of taking care of anybody and everybody who's around you. And I think it is a rare quality to be able to have such a type of a relationship that you have built with colleagues from all over the world. This is not easy, and I think it is certainly something that is very noticeable to me, despite your very busy schedule with so many things on your mind. You're still a person who cares about people. You ask questions, you know about them, you are always trying to help. And these are qualities that are very important for someone to be respected as a leader. So I'm certainly, I think, very impressed with your character. Now, with all these things that you're doing, so much activities, travel, surgery, and so much administrative duties that you have, how do you really de-stress? What do you do to kind of relax and kind of chill down? And at the end of the day, how do you find what are the things that you do to make life easier to continue every day?
So I try to exercise every day. I mean, I do Pilates in the last 10 years, and I go, running. Actually, it's walking. And those days in the forest, we have a beautiful forest near to Istanbul. I spent maybe 1 or 2 days every week in that forest where I can be alone and enjoy the nature and the beauty, the green, and also the lake in this forest. And second thing is I like to read history. And over the last 5 years, I did begin to take philosophy lessons from a philosopher, actually a philosophy, faculty. And we have spent hours on, reviewing the history of philosophy and also history of, medicine in philosophical medicine. So therefore, reading and exercising and spending time with the family on Sunday is full day family day. I never do anything and spend the whole day with my family, try to spend the whole day. And Saturday afternoon also belongs to the family. And 1.5 day, this is not much, but I mean, if you spend intense time with your family, this will be enough for the children and also for the wife.
Yeah, I mean, these are very important secrets about the success of a legend here, Dr. Atish Kadioglu. One last question. I mean, you have been involved with working and collaborating as a friend, as a colleague for a long time. And you have seen the Global Andrology Forum start like a baby. Still, we are a baby. And you have managed some very big organization in andrology and urology in Turkey. How do you see, what is your vision for GAF now? I mean, what do you think about GAF is in terms of its impact now and in the future, and what are some of your advice to us?
So to be honest, I am surprised at the beginning, when GAF was established, I thought, this will be a, low-profile organization, maybe a couple of, Zoom activities, etc. But I am surprised. I mean, with the activities, just Professor Shah did mention with the publications. You reached how many publications? It's more than 100 probably. And, research activities, educational activity. And you did establish a foundation with the Professor Pignera in Austria and set the Global Andrology Forum on a very good basis. So I am surprised, and every day the GAF is growing. And at the beginning, I thought it's going to be a mainly reproductive medicine activities, but over the last 1 or 2 years, the GAF has also sexual medicine activities, surprisingly. So every day I receive 3 or 4 announcements, which is difficult to follow and try to contribute because I am too busy with other societies and other activities. I cannot actually contribute as much as I want to the GAF, but I congratulate you and your core team for bringing GAF in a very short time. It was like a baby. Now it is an adult, and I am sure with these steps, GAF will turn toward one of the major organizations in the world with high academic level education research. And we also did the opportunity to we also had the opportunity to organize the first Congress of GAF attached to our national meeting. Any time to spend with the GAF family is I enjoyed. Again, it is a shame for me not to contribute enough, but I am proud of the GAF management under your leadership.
Thank you very much, Dr. Atish, for your kind words and reflection. I just have one slide, and I will request Daniela to project it. Rupin, if you have any comment or any question from the chat that you would like to bring up at this time, it is up to you.
No, I think there are, of course, many comments in the chat congratulating Professor for a wonderful talk. There are a couple of questions from Tomer which are more technical, but I think we've already run out of time. We're 10 minutes over. So from my side, thank you very much, Professor, for a truly inspiring talk, the perfect inauguration for our online program. And I now hand it over to Ashok, who will wrap up the meeting.
Daniela, can you please share? Okay. Okay. So can we go to the next slide? So this is our one and only slide. I wanted to share with you the online academic session, which will start, as Dr. Rupin has explained, next month, last Saturday. This, Rupin, if you will be kind to explain, I think you are the architect and probably you are best suited to explain this program.
So this is one of various formats that we have. One format is clinical controversies. As I said, there will be others, videos, point, counterpoint, etc. So in this particular case, we're trying to make it as practical as possible. So we will have a moderator who will present certain case scenarios. In this case, the focus is on a very controversial area, and that is the use of testicular sperm in men who have sperm in the ejaculate, despite which there are indications where testicular sperm are used. Now, whether these are justified or not, those are the 4 clinical scenarios that the moderator will present, and then a panel of 3 experts will give their opinion as to how they would deal with that scenario. And we want these sessions to be very interactive. So there'll be somebody monitoring the chat, and the audience attending online will be able to ask questions on the chat, which will be put to the panel. And once the first case scenario is discussed, we'll move on to the next and so on. So for example, here we're talking about different cases, a man with good semen parameters, but elevated sperm DNA fragmentation. Is PSA justified, or are there other methods that would be used? And this would be debated and discussed. Now, what about a practice that many IVF centers do, where the count motility are low, couple of IVFs with ejaculated sperm have failed, and now they tell the andrologist, we want to use testicular sperm. Is there really enough evidence to justify this? Is it the fad? Is it a matter of overkill? Again, practical questions which the moderator will ask the panel, and so on through all the scenarios. So that is the format for the first meeting that we are planning next month.
So thank you, Rupen. The program template is again on a Saturday, which will allow many more people to join. And it will be from 10 a.m., the same time as we started here today. And it will end around after 1 hour. So the next program will be moderated by Dr. Vineet Malhotra, and co-moderator will be Dr. Amarnath. Our panelist will be Professor Christine Wins from Belgium, Professor Salahin Hayan from Turkey, Professor Fotios Dimitriadis from Greece, and Dr. Alexei Rizkov from Russia. And this will be all put together and explained and synthesized by Dr. Rupin Shah. So this is absolutely the format with so many different types of programs planned every other month. I believe that it is going to be a event that nobody should miss, because such type of program has never been conducted in an online format in any part of the world. So we plan to organize this in a concise way so that it is not a burden for people to join, but also the program will be recorded, and we plan to take questions from the audience. So I believe it will be suitable for every type of andrologist and researchers who want to learn about the field of andrology and its complexity that really remains unchallenged. So we want to really educate and learn together in these exercises.